Hi, my name is Leanna, and this is my badge. And today we are performing in IV insertion and IV discontinuing. And then so before we get started, I just want to show my setup. So these are my gloves. Sorry, they're pink. They just work. They're the right size for my hand. This is my hand sanitizer. This is my sharp container. This is my IV starter kit with a tourniquet inside. This is my IV extension cord. And then normal saline, 18 gauze needle. I have a pen, some tape that I already pre-cut on the side, some alcohol pad, and then some gauze. And then before we begin, we called the provider. We confirmed that the provider wants us to insert an IV for a blood transfusion. And then, so what I'm gonna do is I'm gonna first of all, we're gonna enter the room, knock knock, and then I'm gonna pull the curtain to provide some patient privacy. Hi, good evening. My name is Leanna. I'm your nurse for today. So I just called the provider, and the provider wants us to insert an IV so that you can get started for a blood transfusion. But before we get started, are you allergic to anything? No? Okay, perfect. And then can you also verify your name and birthday and date of birth? Okay, so her name is Mary Doe, born January 1st, 1990. We verified on her wristband, it is correct patient. And she has no allergies, so we're gonna get started. So the first thing I'm gonna do is gonna perform some hand hygiene. And then I'm gonna put on some gloves. And then after the glove, so Mary, what I'm gonna do is I'm gonna put the tourniquet around your arm about 2 to 4 inches, or about to where we're gonna insert. And then so I'm gonna tie it like this so that it can be easily released. And then so after that is on, we're gonna check the distal pulse. So it is a mannequin, it's not a full arm. So the distal pulse is there, +2 is normal, it's good. And then so now we're gonna clean the area with some alcohol. We're gonna go in a circular motion. And then we're gonna let that dry out. And then so the next thing we're gonna do is I'm gonna prep the tubing with a normal saline. It is so difficult to know which side it is first. I think it's this side. No, it has to be this one. I think it's this side. No, it's not. It was that side. Okay. And then we're gonna insert the normal saline until you have some water running through, because we don't want any bubbles in there. And then the next thing we're gonna do is we are gonna check the needle. And we are going to make sure that the bubble is facing upwards. And what we're gonna do, okay, so the bubble is upwards. And then what we're gonna do is we are going to go in at a 30 to 45 degree angle. And as soon as I see blood, I'm gonna flatten it out and go in a 1/4 inch more, just so that we can get the catheter to the hub, okay? Okay, so 30 to 45 degree angle. Right, okay, so now that we see blood, I'm gonna flatten it out and then go in a 1/4 inch more. And then so the catheter is at the hub. And then what we're gonna do is I'm gonna click to release. Perfect. And then hold on to that. And then this is gonna go into my sharps container. And then so now that it is released, we are gonna place on the IV extension. I should have just left it off, one hand. Okay. Okay, now that the IV extension is on, before I insert, we're gonna make sure that we see some blood withdrawal, which we do. And then so now we see some blood return. We're gonna we're gonna go in with some normal saline, and we're gonna inject. And then Mary, you let me know if you feel any pain or you feel uncomfortable, okay? And then so we're injecting the normal saline, perfect, and it's all good. And then now we're gonna clamp and remove. And then there was no infiltration, no pain. The patient tolerated well. And so now I am gonna go in with my Tegaderm. I don't have a Tegaderm because I'm redoing this video. Okay, so this is my Tegaderm, and I'm going to put my initial. The date is the 12/18/25. It is about 16 o'clock, and that's like 4 p.m. Pacific time. And then we're gonna put the 18 gauze for the gauge, and then we're gonna stick this right on the catheter. These are very difficult. See, like there it is. I didn't see that last time. Okay, so now we're gonna remove this, the edges. And then it's not sticking very well because I'm redoing the video, and the normal saline is just coming back out of the mannequin, so it's not sticking. Okay, and then now I have my pre-cup tape, and then we are gonna tape the tubing to so that it doesn't fly everywhere. And then so patient tolerated the procedure well. We clamped it and discontinued the syringe, and then we transdermal it already. And then now I'm gonna clean up the area. Make sure I get all my trash out of the way. And then Mary, before I leave, do you have any questions for me? No? Okay, so Mary doesn't have any question. As I said before, tolerated the procedure very well. No pain or discomfort. We're gonna put the bed in the lowest position possible to make sure the patient is safe. Call out It's in Reach. Mary, if you do have any question, feel free to reach out to us and let us know. And then so I have all my trash all cleaned up already. I'm gonna remove my gloves, and then we are gonna perform hand hygiene. And then, okay, so that's it for the insertion of the IV. So the next thing that we're gonna do is we're gonna discontinue the IV. So for the discontinuation of the IV, I'm going to make sure that I have some gauze, and then some tape. And then I already have some pre-cut tape on the side, and then my hand sanitizer and my glove. And then so we're gonna remove all that because that's still trash from the other video. And then, okay, so we're gonna call the provider. So the provider told us that, we have an order to remove the IV now. So, in the previous video, I forgot to remove the tourniquet. This is so bad. Okay, so we removed the tourniquet before we inserted the IV extension. Okay, so we're gonna restart the discontinuing part. So I have my setup already, the hand sanitizer, gloves, some gauze, some tape. We're gonna call the provider. The provider let us know that he wanted us to discontinue the IV. And then so what we're gonna do is we're gonna enter the patient's room now. So knock, knock. Hi, Mary. So the provider just called us to let us know that it's time for us to remove your IV. So the first thing I'm gonna do is that I'm gonna pull the curtain to provide some patient privacy. And then I'm gonna perform some hand hygiene. And then I'm gonna put on some gloves. And then, so Mary, can I just have you verify your name and birthday? So it's Mary Doe, January 1st, 1990. We verified that on your wristband, so it is the correct patient. Okay, so Mary, I'm gonna remove the tape, and then we're gonna remove your IV. You just let me know if you feel any pain or discomfort, okay? So the first thing I'm gonna do is I'm gonna release the tape, and then look around while holding down the catheter. And then we got the Tegaderm off, and then we're gonna get some gauze, put it right over where the catheter is. Got the tape off, and then now that we have that off, I'm gonna remove the catheter, And then we're gonna check to make sure that everything's in place. There's no broken pieces that we have to worry about. Look like everything's intact. And then that's perfect. So we're gonna dispose that in the trash, and then we're gonna get some new gauze, and then we're gonna place it right over, and then we're gonna tape. And then Mary, before I leave, do you have any questions for me? And then Mary is like, that's it. Yes, that's it. We're all done. Mary doesn't have any question. The tape is not sticking very well to this mannequin. So now that Mary doesn't have any question, we're gonna lower the bed to the safest position possible, and then call ice within reach. Mary, if you do have any question, or you're experiencing any type of rashes, itchiness, or any type of irritation, you go ahead and let us know. And then so I dispose all my trash. I'm gonna remove my gloves and then perform hand hygiene. Okay, thank you, Mary, and then that is all.